Well, I think as we start to look at the integrated systems are going to play a key role in how everything fits together. And that's the HIS, coming from the EMR, coming from CPOE. So you're starting to have rules and the rest put in place that hopefully down the road will cut down some of the back and forth, so that if it's required that, that there's rules-based systems that says if I want to order an MR, if there's contraindications that says, well, wait a minute, whether it's first trimester, implantables, whatever it is, that information is going to be there on the front end that comes up as warnings to the ordering physicians. I find that to be exciting, that you start to look at these rule-based systems that are going to come out, that are going to interact, so that by the time the information comes, it's kind of been cleansed before it gets to us. Maybe accurate, better accuracy, allergies, looking at the National Patient Safety Goals, so that I know that when I get all of my orders, that I know that it's exact, and if I follow my rules and the rest, it'll be fine. And then as we go through our systems of acquiring the data, getting the report, making sure that what's needed to the referring physician is sent back. And as you look at some of the systems now, we can actually embed, images inside the reports, get them back to them, show signs of interest. Now you're starting to see notes coming up, so you can send emails back and forth, so that there's a lot of things that are coming into play that used to be separate systems, which will now be more integrated to make the radiologist's life happy, and then which will make the referring physician happy. Those are exciting, that we're starting to look across the enterprise, not just at silos. I guess that's the best way, is silos. We're not looking across the silos. We're looking across the industry that says, what do we need to do? And we're going to have to look beyond the hospital walls or practice walls that says, how do I get this information outside? And how do I make it available to people that may not be associated with the hospital, but they're still referring to us? So it's very different, challenging times in spite of everything else that's going on.